Mrs. Kim and Mrs. Kim's son. How are you guys doing today? What brought you in?
So my mother was diagnosed last week with a UTI, a lower UTI, and we're just here for a follow-up visit. Um, Her UTI kind of was giving her some trouble. Like she was had to pee all the time, was holding it in a lot, and it also made her knee arthritis flare up a bit. So we came in last week. The doctor, I think, or the nurse practitioner, maybe it was, prescribed her nitrofurantoin, I think is what it's called, and she took that once a day for 5 days. And now we're kind of just here for a follow-up visit. But I just had a couple questions. I was just wondering, one, how did my mother get this UTI, and how can I help her prevent it in the future?
You have to stop worrying about me so much. I'm fine.
Well, those are actually very valid questions. Thank you so much for asking, and thank you so much for coming to this telehealth appointment in these very interesting times. We actually created a UTI PowerPoint for all of our patients that have UTIs to help educate them about it and how they could prevent it in the future. So let me show that to you.
Oh, wow. Thank you so much.
What is a urinary tract infection, also known as a UTI? It is a condition in which bacteria from the skin or rectal area enter the urethra, which is the tube that carries urine from your bladder out of your body. When an abnormal amount of bacteria or unhealthy bacteria enter the urinary tract, they can cause an infection in any part of the urinary system, including the urethra, the bladder, the ureters, and the kidneys. Doctors will classify the type of UTI that a patient has based off the location of the infection, describing it either as an upper UTI or a lower UTI. Urinary tract infections are a very common type of infection, and those diagnosed with one often report experiencing pain or a burning sensation while urinating, as well as the frequent urge to void.
Pathophysiology of a urinary tract infection. It starts when bacteria gets into the urine, and the bacteria travels up the urethra and continues to travel to the bladder. The bacteria in the bladder begins to multiply and release toxins which damage the bladder. An inflammatory response elicits from the bacterial invasion, which can cause more damage, and it's really important to get this treated because if not, the bacteria can continue to travel up the ureters, eventually sending to the kidney.
There are two common types of UTIs. The first is a lower UTI, also known as cystitis. It is an infection of the bladder or the urethra. An upper UTI, known as pyelonephritis, is an infection above the bladder, usually the kidneys or the ureters. Clinical manifestations of a lower UTI include difficulty urinating, urgency, frequency waking up in the middle of the night to urinate, suprapubic heaviness or pain, gross hematuria, which is blood in the urine. Upper UTI signs and symptoms include fever, chills, pain in the hips and ribs, nausea, vomiting, malaise, with or without typical lower UTI symptoms. A physical exam may include a check for costovertebral tenderness, which is underneath the ribs by the kidneys. Labs for both upper UTI and lower UTI may check for bacteria in the urine, pyuria, pus in the urine, or may check for positive nitrates, which indicates that bacteria is there because commonly bacteria produce nitrates. Leukocyte esterase indicates that white blood cells are there, and they tend to convene in an area of infection.
There are various risk factors associated with developing a UTI, such as urinary stasis, in which an individual either decreases their fluid intake or is holding in their urine and allowing bacteria more time to attach and multiply. This should be avoided by going to the bathroom, as the urine will flush the bacteria that has not yet attached. Having a female anatomy consisting of a shorter urethra that is approximately 4 centimeters long makes it easier for the bacteria to ascend. Old age and postmenopausal women are also other risk factors, as there's a decrease in estrogen, causing the urethral tissue to be more fragile and prone to infection. Structural abnormalities, such as VUR, is also a risk factor. VUR is typically diagnosed in children, and it consists of either one or both of the ureterovesical junctions not functioning as a one-way valve and allowing the urine to reflux back to the kidney, causing scarring in the ureters. Improper hygiene, for example, wiping back to front, is another risk factor as it spreads the bacteria towards the urethra. Prior UTIs, recent sexual activity, using spermicides and diaphragm are other risk factors of UTI. Diabetes and chronic kidney disease can also be risk factors as the kidneys spill glucose into the urine and can promote bacterial growth. Pregnancy is another risk factor because progesterone relaxes the ureters, leading to reflux of urine. In addition, there's immunosuppression that's related to pregnancy and could lead to a reduction in the immune response to urinary bacteria. Lastly, catheterization and using other instrumentation can introduce foreign objects into the urinary tract, thus promoting infection.
How do you prevent a future UTI? The best ways to prevent a future UTI include making sure you are getting adequate hydration every single day. This will help make sure that you go to the bathroom frequently enough to flush out any unfriendly bacteria that's in your urethra. Avoid or limit caffeine and alcohol intake and promote good hygiene in the genital and urinary region. Wash the vaginal area at least once a day with an unperfumed soap and wipe front to back after going to the bathroom. This will prevent any bacteria that's in the rectal region from coming to the urethral region and causing an infection. Having wet wipes available in the bathroom may encourage good hygiene because it'll thoroughly clean the area and prevent any unfriendly bacteria from entering. Asking your doctor or an NP for a low-dose vaginal cream to rejuvenate the skin and support the presence of good bacteria is especially important for postmenopausal women whose low estrogen levels in their body makes their skin more prone to abrasions. Look out for dark urine, which is a sign for dehydration, and if you see your urine turning dark, make sure to up your water intake to 6 to 8 glasses of water a day. Avoid becoming constipated because that can prevent the bladder from emptying properly, giving the bacteria more time to latch on and cause an infection. Eating foods high in fiber and drinking plenty of fluids, as well as getting exercise, will all help to keep the bowels moving and prevent constipation.
A urinary tract infection is just an infection occurring along the urinary tract. There are 2 types. The first one is a lower UTI infection, also known as cystitis, which is just an infection confined to the bladder and or urethra. As we can see here, some signs and symptoms are pain when urinating and having the urgency and frequency of going to the bathroom. Then if the infection travels up and ascends to the kidneys, it's known as an upper UTI infection, also known as pyelonephritis, which is just an infection above the bladder, and some signs and symptoms of that are fevers, chills, and flank pain. Risk factors for developing a UTI are holding it in, having a shorter urethra, which is just part of the female anatomy, older age, so about 65 years and older, and some things to do to prevent a UTI are just increasing your fluid intake, just staying hydrated, making sure when you're going to the bathroom, wiping front to back and not holding it in.
But one question. It hurts me to go to the bathroom because of my knee. So I see that it's very important for me to go to the bathroom often, but how do I go about the situation without hurting my knee anymore?
Is there a bathroom that is near where you are during the day or where you sleep at night?
Yeah, but it hurts to walk to the bathroom.
Mom, I can help you.
Is there a way you can reach him when you need to go to the bathroom?
Yeah, I could always call him.
That sounds like a really good plan. Can you just repeat some things back to me, some main points about what you learned?
I'm more prone to UTIs because of my elder age, being born female, holding in my pee because of my knee, and being postmenopausal. And some things I could do to prevent getting a UTI in the future would be to make sure that I drink enough fluid and I'm going to the bathroom as often as possible, and maybe getting a prescription for a vaginal cream.
That's really great. Thank you so much for coming today. I hope that you stay healthy and stay safe.
Yes,
Thank you
thank you
so
so
much.
much.